you're welcome to my platform. I am Dr. Sandra and I am a surgeon. I hope you become aware and sensitized about the different surgical conditions. Today's video is about preauricular pits. A preauricular pit is a small opening, a dimple, a dent that is present at birth, usually on the front part of the ear, just above the ear canal, the ear opening, common in children. Just beneath or attached to the preauricular pit is a small tract, a tunnel that ends blindly into the tissues of the ear. A preauricular pit is a result of failure of fusion of the tubercles, the structures that are supposed to come together to fuse and form the pinna, that is the outer ear. This usually happens around the 6th week of gestation when the unborn child is still in the uterus. And if this does not happen, we shall end up with a preauricular pit. That is a dimple on the skin, but it is connected to a sinus, that is a tract that ends blindly into the tissues of the ear. The common sites where we find the preauricular pit is the root of the helix and on the tragus of the ear. The clinical presentation of preauricular pits is that they are usually common in childhood and they can be on both ears or on just one ear, but majority of the time they are on one ear. They can be multiple, that is many in number, or they can be just one, a single pit on the ear. So if you happen to see these pits on the ears of your children, I highly recommend that please look out for the following signs and symptoms. Please look out for pain. For example, you touch the child's ears and they are in pain. Please look out for reddening, swelling, and discharge from the pits. I also recommend that you bring these children for evaluation by the ear, nose, and throat surgeons. They will help us to evaluate the pits and also look out for these complications that I've just laid out for you, the signs and symptoms that I've just laid out for you. They also help us to evaluate the child for other abnormalities on the body. For example, asymmetry of the ears. They can also look at the tongue because there is a condition that can also be associated with these pits, and this condition is very dangerous because it presents with asymmetry of the ears, that is, the ears are not equal in size. The child usually has a big tongue, and sometimes they also have cancers of the liver and the kidneys. This condition is called the Brancho Syndrome. So it is very important that you bring these children for evaluation, such that if they have this condition, they can be managed on time. The ear, nose, and throat surgeon can also help us to rule out a possibility of another condition, that is the Brancho Syndrome, which is associated with the pits on the ears, but also some abnormalities on the neck. And the child can also have hearing loss and hidden problems. The condition is called Brancho Syndrome. So if you bring this child to the ear, nose, and throat surgeons, they can help us diagnose those children, and they can refer these children maybe for further management, just in case they have maybe organic problems. They have problems with their organs. For example, maybe they seem to be having cancers of the liver or cancers of the kidneys, or they have kidney problems in association with the pits. The investigations that we carry out in preauricular pits include a discharge study where we take off a sample of pus from the pits. Just in case there is pus coming out of the pits, we take off a sample of that pus and then we look out for any presence of bacteria in the pus. We also do an audiogram because, like I've just detailed, there are some conditions associated with these pits that can easily cause hearing loss. For example, the Brancho Syndrome. We also do a CT scan or MRI sinusogram. We also do abdominal ultrasound scan to look at the organs, for example, the kidneys, the liver, looking out for any enlargement of these organs or any abnormalities of these organs. We also do CRP and ESR. When it comes to the treatment of the preauricular pits, the following can be employed. We can do watchful waiting, and this entails leaving the pits alone if we don't have any complications. For example, if we don't have any swelling, reddening, or formation of a mass just beside the pit. This mass can be as a result of cyst formation. And we can also do antibiotic therapy just in case we have any swelling or reddening. And if we have repeated episodes of infection, it is best we do excision of the pit and the entire tract. That is, we do surgical excision of the tract. So the take-home message is that if your child happens to have these pits on their ears, be on the lookout for the signs and symptoms that can point to an infection. For example, look out for reddening, discharge, swelling, scarring. And also it is important that you take these children to the ear, nose and throat surgeons for an evaluation of these pits and also an evaluation for other associated conditions. Yes, that is what I had for you. Thank you so much for listening to me. Please share my videos and also subscribe. See you in my next video. Bye.